He said, you have to go right to the hospital. Because right before that, I said, I have like a really fun thing I planned with friends for after school. I saved $20 on my test strips with this coupon or this prescription discount card.
I was a JDRF mentor. I think is what they called it. They called them.
It used to be that. If you're fighting for medicine and food, no, you're not worried about helping other people. One of our children suffers from endometriosis, and we've been in and out of hospitals, and quite often females are not believed.
Well, hello and welcome. Sally Figuerera is in the house. Thank you so much for coming on and joining and getting to know our listeners.
Absolutely. I'm excited.
Yes, yes. And you and I have been back and forth, it seems like, for a while now, just online. Thank goodness for online, right?
I know. Yes, absolutely.
Yeah, just the connections and the meeting. Many of the guests that have been on the show, experts or just women in the field that are living with the disease or in the field or whatever, all different scenarios as to why they're connected to type 1. I've met so many of you here on the show, and some of you come back. So real relationships are being built, and that's the best. That's one of the best parts of of doing all this. So you've obviously been living with type 1 yourself for some years. And another thing, you have an exciting project coming that's launched already. So we're going to just talk about that a little bit. And it's something I think everybody can relate to, because the cost of diabetes is expensive. And whether or not you have insurance or not, or whatever that looks like, in each of our pocketbooks, it's a very important and something, and it's a resource. And this is something that you're making available to all of us with chronic disease to find ways to save money and to share what we've learned. And you and I were talking a little bit before we hit record today about that just kind of naturally happens when you're living in a chronic disease.
I don't know how far back to go. Like the day I was born, I'm kidding. But I've had type 1. I was diagnosed at 12. So that's like 30 some years. And my diagnosis story, I did a video on it. It was kind of funny. So I'll share. It was, 6th grade, had a big thing planned after school with friends. And I'm kind of glad my dad isn't still alive to hear this, but we were going to play Spin the Bottle. And that was a big deal. So my mother was a nurse, and she noticed that I was losing weight, like dramatically.
Yeah.
And in like a 2-week span, I was lucky that she's a nurse to even catch on to anything. So she didn't tell me. She just said, we're going to go to the doctor. He took my blood sugar, and you have type 1 diabetes. He said, you do not pass go, you do not collect, what's it called, in the game of Monopoly.
Right.
And he said, you go straight to the
Right. You don't collect $200 and go.
That's it. He said, no, yeah. He said, you have to go right to the hospital. Because right before that, I said, I have like a really fun thing I planned with friends for after school. That's like an hour from now. Could I please go? I had no idea the severity or whatever diabetes was. So yeah, that's how it started. My life dealing with chronic illnesses. And then fast forward a bunch, I was then diagnosed with rheumatoid arthritis, which I had no idea that once you have one autoimmune disease, you might develop others. I kind of thought, I'm already being punished. I won't get another one. Well, you know what I mean?
I know. We did think that in the early days. It's like, what did I do wrong? Well, little did we know that we're actually using it for other purposes, aren't we?
Right.
That's the way I like to look at it.
So with I was involved with, Juvenile Diabetes Research Foundation, which I used to be. They're now Breakthrough T1D. I was part of their outreach program. They changed the names for newly diagnosed children. Usually it was like families, or if it were someone older. But what I found that kept happening, people would sign up, kind of like with me doing this with you, and they'd reschedule over and over. Or I just think anyway, one day I was like, maybe I could contact some people online, because I know they want to talk to someone, but kind of hiding behind your computer is just easier.
Yeah.
And I was having success, but just not enough for how many people that Breakthrough T1D was telling me were newly diagnosed and are interested in talking to someone. So also after I was diagnosed with rheumatoid arthritis, I just started questioning things like, why is this happening? Why are so many bad things happening? And some personal stuff I won't get into. But one day I thought, maybe all this stuff happens to me so I can utilize it to help other people, because I still think I have a great life. My husband doesn't agree. He's like, you're always in pain and your blood sugar's here and there. But I'm like, no, I still do, So So started that, just making videos on social media, talking about tips or products I use, anything like that. And then through all that, it was like glaringly obvious that affording healthcare was the number one need for people with chronic illness. But honestly, in this country, it's like it's so many people.
Yeah.
And I kept finding all these ways that I didn't know about. Sorry, I got to take a sip. Meaning manufacturers, copay programs, just all of these ways to make care more affordable that already exist. And as I started sharing these, I was realizing like, oh, it's not just me. A lot of people don't know this stuff. And it's there. It comes from the drug makers. It comes from insurance programs, not widely advertised, right? Because no one wants to be like, well, don't spend your money when you spend your money. So started sharing that. And then fast forward, I met this guy he was working with me through a social media agency. And he said, this could be put into like a website and really help people. And so that's what we're doing. We created like this hub. And right now it says health savings expert. I want to change that and add the S at the end, health savings experts, because the whole point is you go on and you share how you learned something. I saved $20 on my test strips with this coupon or this prescription discount card. Was funny because no one really thinks about that. Everyone says, I don't know, all I've done is lose money. But if everyone's sharing their examples, then there you have this I like to say arsenal of ways to save money. And that is the goal. And I want it also to be just a community where people feel understood. Because if you have any chronic illness, you're suffering in some way. And it's nice to talk to people who can relate, right?
Yeah. Anytime we can take something off of our worry plate, right? And I think, and you can speak into rheumatoid arthritis. I honestly don't know what that really is to manage or what that must feel like, I guess, is something I can imagine. But when we have a disease that doesn't take a day off, and we can't take a month off from our supplies if we need them every month, we have a disease that is constant. And there are people that do without, which is tragic. I'm sure you've heard of stories as well, whether it's insulin rationing or just skipping, testing as often, doing the things that ultimately save money, pain, and suffering. Right?
100%.
I'm all about prevention, right?
Yeah.
And, one of the things too, I think, is when we can help each other and partner in this, because obviously nobody wants to spend more than we have to. Again, and I'll probably be mentioning insurance or not insurance, but I will say that the health savings, and this is just an example of one of the things that you do talk about and is listed on your site, is they're called health savings. It's like cards. They're like a coupon cards. And it's interesting because I got off looking for those. I found them years ago where I was using them.
The prescription discount cards?
Yeah.
Okay,
And it helped. It helped. Again, I'm very blessed to have good insurance. My husband and I both live with type 1 diabetes.
I know, it's crazy.
Double the expense in the slump household, right?
Yeah.
So times 2. But we were doing that. And then I think what happened is our copays got a little bit easier to manage because I guess our insurance changes like it does every year, the copay program or whatever. So I stopped looking for them, but they're really easy to find. I know that's
So
maybe
many.
if nobody walks away with anything else today, if they learn this.
Really?
Yeah.
I mean, I made many videos to try and make it easier for people, but I couldn't believe how many existed. And all of these ways that I have found, it really takes effort. It takes effort on our part. But if you do the due diligence, you're going to save money. So for example, GoodRx, which is huge, that's one, or one that's lesser known, let's say Single Care. Each one of these has a contract, an agreement with different pharmacies. So you could go look for your insulin at CVS, and with their discount card, it might be $20 versus you go over to Walmart and you could get it, what's probably around $12. But so what I'm saying is like, these things exist. It's not easy because why would it be easy? Right? They want you to spend more money. And I just felt like all of this stuff I still feel like it's just sitting there. People are just slowly starting to find out. And then, the manufacturers, actually, I'm going through it right now with my insurance for my rheumatoid arthritis, they just dropped my coverage.
Oh.
And I went through this battle last year. They wanted me to try a different biosimilar.
Mm.
And anyway, didn't go well. I regressed and going through the same thing now. But even with this, I'm learning ways. I might just move to Germany because apparently I can get the
Oh, no.
medicine there for free, which is just, I
Yeah.
know.
Yeah.
But even with that, as I'm learning, I just going to share this stuff with people because so many people in specialty meds deal with this,
Mm-hmm. Mm-hmm.
and
Yeah.
it's crazy. And I have found things like I have insurance, so my drug was covered for my insurance, luckily. But then it was a $500 copay every month.
Mm.
And even that is significant.
Sure.
But I did some research and I found that they had this manufacturer's copay program you could be part of. And then I
Mm-hmm.
paid $0. And then I found out you don't have insurance whatsoever. If you apply for these things, you might get that medicine and spend zero, even if you don't have insurance.
Mm. Mm.
Isn't that incredible?
That is, that is. And it's not being talked about enough. No. And
Yeah.
you know what I love too, what you're doing, because you mentioned obviously the awareness, your site and this site, this is a nonprofit. This is something that you've put
Yes.
together again to serve and to help. It's doing the heavy lifting because think about all the information that you're gathering and the other experts are contributing.
Mm-hmm.
It's like, and again, I'm just imagining this because I have been on your site, so I have
Mm-hmm.
seen it. Yeah. And it's information, it's information, it's information, which is good because that is loading it up where somebody who says, oh, well, I hear there's ways to save money. I just don't know where to
Right.
start. So I
Right.
think the fact that you have a hub where they can land there and
Mm-hmm.
start there and get started. So like I was saying, you're doing the heavy lifting because you're getting this thing going and you're
Mm-hmm.
raising awareness over it.
Right.
Because I think what happens too when we get discouraged about something, especially when it comes to saving money on something we need to survive, it can weigh on our disease. It can weigh on our day to day. And that worry adds on to more worry. It can be a spiral. And ultimately, our health suffers. And that's the tragedy. I think this is so good because this is a very proactive way, whether or not, you and I, we've been living 30, 40 plus years with this disease or somebody newly diagnosed.
Mm-hmm.
You mentioned the breakthrough T1D. I was a JDRF mentor. I think is what they called it. They called them.
It used to be that.
You remember that? Yeah, we did that as well. And I remember, those newly diagnosed families, how many, and they were all different situations, but
Right.
just how discouraged they started out, just, not understanding really what to expect. So the expectations was very scary about not only living with the disease, but affording the disease. So,
Yeah, and that
yeah.
was another reason I wanted to get into it because I have 4 healthy children. And I know
Mm,
that is so scary as a T1D parent. Well, I'm not that, but I have the disease, but how fearful for them, like, oh, my child will never have kids and they're going to
yeah.
be so sick. And it can go that route, but
Mm-hmm.
you put the effort in, it doesn't go that route.
Right. Absolutely. It is all about that for sure. So what are you seeing besides, well, do you have some examples of people that you've met? Because I know this is still early stage of
Hmm.
this amazing site that you're providing the community. What have you already witnessed and experienced? I love before and after or guess what stories
Yeah.
of people that are, that are
Well,
taking advantage.
yeah, this is very small example, but massive. And I told my
Mm-hmm.
husband, like, because we've been supporting this all with our own money and we've spent a lot. But this one guy, probably last year, he found me from one of my videos on Instagram and he had no idea how to get glucose. He didn't know about it. And he had 2 type 1 children.
Mm.
And he's like, I can't afford to go to the doctor. Sometimes, we're rationing insulin. And I was able to share with him there's these organizations like Insulin for Life. There's
Mm-hmm.
organizations everywhere that people should know about, like
Mm-hmm.
even right outside of Philadelphia. I'm a part of some groups there. And people help each other out by like giving insulin to each other or here,
Sure.
I have a setting for you. And
Sure.
if you want this, I'll meet you. And
Yeah.
but that alone, he kept writing me saying, I did this, I did that. And
Mm.
using these things for the poor guy, for his little kids, I can't even fathom.
Yeah.
So that was a big win. I've met some people are very intelligent and part of other companies that truly do care, because chronic illness affects so many people. Even if it's not you, it's your child, it's your aunt, it's your mom,
Sure.
especially when you talk about parents getting older.
Yeah.
And uh, that's the point. It touches on everyone. And
Hmm.
I have found some people who really want to make a difference, who would love to jump on the website and say, this is what we could provide.
Yeah.
So,
Yeah.
yeah.
Well, walk us through what exactly have you added to the site at this point? So if somebody were to hop on and visit your site, what can they expect to find and
Lots and lots of
experience?
categories, like just afford your medicine. We had some bigger titles and realized just make it very factual.
Yeah,
It's like I said,
just
because
get
if
to the
I'm a
point, right?
yeah, if it's me or I'm a parent looking on there, maybe I don't want to read this long article. I just want to find the insulin. So it could be that. It could be there's organizations like, for example, the PAN Foundation is wonderful. You do know PAN?
No, no,
It's
no, I can't believe. Yes, I want to learn some stuff today too.
yeah.
So go for
You
it.
should write it down. Write it down. PAN PAN Foundation.
PAN. Okay.
They do so much for people, so much. And there's others like that you can contact someone there. They will get all your information and they will be your advocate to help you get what you need. So I go back to that a lot. There's a lot of people who truly want to help and are helping.
Yeah.
We just need to get more awareness.
Yeah. Yeah.
So there's a lot of good examples on there, different ways to save and just ways to try and deal with your disease.
Hmm.
Examples I've given and other people, lots of other people.
Yeah.
It's just really informative. We're starting a newsletter to give tips on monthly on saving. What was the other thing? Oh, I was going to do Amazon gift cards for people contributing. Like, yeah,
Nice.
kind of like when we did the mentor program or outreach. People don't just willingly come up and here's my story and here's how I saved, but maybe with a little incentive
Yeah.
and get out there first.
Get
Yeah,
them more free and sharing. Yeah, that's
yeah,
really good.
yeah.
Yeah. So is there direct access to say, and this is, and I'm just going to throw names and pharmaceuticals out there because that's just kind of what we do here on the show. And I haven't had anybody come back and say, why did you say that? I mean, I use Omnipod 5, use an insulin that is made by Novo Nordisk, Fios, Novolog. And you can share whatever supplies you're using or whatever sort of system you're using if you feel comfortable with that, Sally. But that was one thing that I did do. Novo Nordisk has got access on their site for health savings. And again, I think I'm saying all this right. I
Well,
think
no, it's
that's what they
confused
called it.
me.
Discount cards yeah, they have different terms for it.
Mm-hmm.
And again, if you can do a little digging and it might take you a few minutes. It all depends on, what's your motivation and intention on really finding it and getting to it. It's clearly not as hard as you think it is. I think once you kind of create a kind of like a member ID or some sort of a sign on, I forget even. And then you literally just print out a card that you take to I used to take it to the pharmacy.
Yeah.
And they would add it on to how I'll just say the way that they rung it up. That's a term
Yes.
we use in our, in our generations.
Mm-hmm.
You're at the cashier and they're just adding it all in, with or without insurance or whatever. And then, okay, here's your balance due. And it would, a lot of things, it was like, it would say, let's say it was a vial of insulin. I'm trying to think of examples. I think generally I only ever used it for insulin because insulin started to get expensive years ago.
Yeah.
We used to be able to go to Walmart and get a vial of insulin for like $10, $12, remember?
Mm-hmm. Yeah.
And I don't even know what it cost over the counter now. I've heard
Yeah.
different stories, and I think it depends on where you buy it, right?
Well, I think I already mentioned GoodRx.
Yeah, you mentioned that.
I
Yeah.
don't even get paid anything, and I just mention their name.
Yeah.
But one time something happened with my insurance. I can't remember. For my CGMs, I used the Dexcom G7.
Same here. Yes.
Yeah. Couldn't get it through insurance for some reason. I don't know what the issue was. But anyway, GoodRx had a discount coupon and I got the monthly supply of 3 for I don't know, it was something like $80 where it would have been 400.
Yeah.
And I was super impressed.
Sure.
Yeah, and it's
Sure.
just
Yeah.
taking the time to look through this stuff and figure out where
Yeah.
you can get your yeah.
Yeah. Yeah. Do you think and I'll call it the generosity of whether it's the pharmaceuticals or the supply companies, where do you think that generosity begins? It's kind of like, you always, the old saying with, and this is kind of a side note, and this may sound funny, me even saying this, but I remember, and it was probably my husband, when it comes to buying jewelry, he always says you come home with a good deal on a bracelet. He's like, well, the markup, right?
Yeah,
So
yeah,
they're still making money. And
right.
that's kind of the same philosophy. I mean, again, businesses don't go into business, to necessarily give things away. So that there is that margin. And then I hear that it's oh my gosh, again, I was not prepared to create this name, but there's that, there's that level in the middle. So it's the pharma, and then there's somebody else, it's like the negotiator that's actually getting
Yeah.
part of that. There's all these different things when it comes time for the prescription to be filled, the pharmacy to decide,
Mhm.
what they're going to sell it to. But anyway, but
Well,
I
I
did,
I don't think
yeah,
it's generosity on the part of some of these insurance companies and pharmacies. Not to say everyone's bad, but
yeah.
they're making hand over
They're still
fist
making money, yeah.
tons,
Yeah.
tons and tons. And these things exist. Like, I'm not saying let's create a bunch of ways for people to save. Let's just share this, and they're there.
Mhm.
So Eli Lilly makes my insulin and one of my Humira drugs, and I've been able to get copays scratched out of each. And I don't think that was to be generous because
Yeah.
it just, you want your patients to use your products. So if you're
Mm,
helping them use it, you're getting a discount. They're still making money, which
yeah.
is great for both.
Sure. Sure. Understood.
Yeah.
Yeah.
So there's something I wanted to tell you and I forgot.
No, that's fine. Yeah. I just wanted to, when I think another thing too, and again, I'm not trying to throw out, oh, you know what? This is my show. I can say what I want.
Love it.
Today's February 17th. So about a week ago, I want to say it was a week ago, the government just announced a discount prescription site. It just happened.
I
Oh,
know.
it's called Trump RX, I believe, is what it's called.
Mhm.
Gov, I think. And again, out of curiosity, I went on there and I was looking around just to see. I think it's something that is still being built as far as
Right.
who's coming on and really to prove. And that's an interesting thing too. And of course, as soon as I heard about it, I thought of you because I knew we'd
Mhm.
be on here talking about this. Again, that's another avenue. And again,
For sure.
yeah, it definitely is. And I think the best thing is that, they're realizing the cost. They're realizing people are like, hey, we need help. We can't afford to keep doing this. Show more accountability for these drug companies to kind of meet in the middle somewhere, or
Yeah.
maybe even more so. Yeah.
I met this man and hopefully we're going to kind of pair up, work together. His company buys medicine from out of the country,
Hmm.
brings it here, sells it at dramatic discounts. They basically make agreements with the insurance. Like, for example, they go to a company, let's just say they say, we can get you, if you go with us at this program, this is how much you'll pay. So the company goes through them rather than the big insurance company just to make it less, but insurance still pays for it. Regarding that, I haven't talked about the Trump RX yet because I don't know much about it.
Yeah. Yeah. It's
And
still
some
early. Yeah.
words, just saying some words, fire people up. And I don't want to be doing that, right?
Mhm.
This is just for everyone. I'm not here to say, let's pick sides. And that's why I avoid it for now.
Okay.
Hopefully what he's doing is great. I just feel like
Hmm.
if I start talking about how people just and I understand it's sad. And that's kind of why another reason I love this, because I find like people innately want to do good. They want to help
Hmm. Hmm.
if their basic needs are met. If you're fighting for medicine and food, no, you're not worried about helping other people.
Sure.
And this is a way for us to help each other.
Hmm.
And I've talked to my kids about this too, and so stressed when they see the news and oh, these things are so horrible, and they are. But they also obviously that sells better than positive news.
That's so
But I
true. Yes.
yeah, I'm like
Yes. Hmm.
do something for others so
Hmm.
you feel like you're contributing because you really are contributing.
Yeah.
And that's another reason I love this.
Yeah. Yeah.
And just like an answer to some way to make things better.
Yeah.
Yeah.
Yeah. Yeah. I love that. I think, we all need to get up and do the best we can to be part of the solution.
Hmm.
Right.
Hmm.
Just to kind of fill the situation, the issue that, or, whatever that problem may seem to be in front of everyone or whatever, and just kind of try to find, like, just like what you said, instead of adding to it and making and firing it up, let's find a way that, that we can be part of the solution.
Yeah.
And yeah,
Right.
it's all about
Exactly.
light.
Yeah.
We don't need any more darkness. We need
We
more
don't.
light.
And I like this also because it's not, to me, it's not political. All these ways
No,
to save already
no.
exist, as I've said.
Hmm.
So it's already out there. We just want the awareness to be there and
Yeah.
people to utilize it and make their lives easier.
Yeah.
So, if some person is like hates the company that has this copay card, well, that's your business. Don't go to them. But the whole point is here are all the resources. Here are all
Right.
the ways we
Right.
can afford it better.
Right.
Or even get a ton of stuff for free. If you don't have insurance and
Hmm.
you apply for a bunch of these and you'll probably meet what they need you to meet, like something about the percentage of the poverty level or
Right, right, the income
that's
level.
like
Sure. Would you like to share a little bit about maybe your journey with type 1, with insulin
Mhm.
dependent diabetes and arthritis? And that I've had a chance to get to know you a little bit and follow you. And I know you're very real about your experience, which is, I think, what people, and that's why a lot of the listeners keep showing up here, is because, we bring
Yeah.
ladies on that, and a couple men, there's a few men that kind of weave in here once
Mm.
in a while. We always welcome them. I was told the other day, because my husband was on the show about 4 weeks ago. I finally got him to come on because, again, he lives with insulin dependent diabetes.
Yeah.
And you know how you get your own thinking about what the show's purpose is, because, again, I'm a midlife woman, menopause, hormones, that's
Mhm.
the whole thing. So we get tunneled about what we're doing. And then it's like, well, the title, type 1 in midlife, it could be for men too.
Yeah.
Isn't that funny? It's just one of those things that can easily get misinterpreted.
Well,
It's just one of those things, that we have to catch ourselves on. So I do know we have men listeners. So anyway, with that note,
no, that's great. And
yeah,
men just don't talk as easily, obviously, as women do and open up, and not all, but
so true. Yeah.
so the two diseases together, like right
Mm,
now, it's brutal.
mm,
Because insurance rejected the medicine I needed to be on, I now have fluid building up in my knee and I have tons of pain. Probably doesn't look like it right now. I know I'm smiling, but we
uh,
smile through a lot of this stuff, right?
yeah.
So I can't do my walks as I normally do, and my blood sugars are out of whack and just the stress of it. So the two diseases, yeah, it makes it a whole lot harder. But I keep at it. It's interesting. Like movement is for so many diseases. Then you get arthritis, and you think people are always like, sit down, take it easy. And
Right.
sometimes you got to do that, but you have to balance it. Or otherwise your joints tighten up and you
Okay.
get worse and worse. So
Mm,
it's this constant balancing.
mm,
Kind of like with diabetes,
yeah.
I got to walk. My blood sugar's a little up. And, sometimes, like right now, I can't do my walk. So I try to do some other stuff. I'm glad it's not just me.
Yeah. Yeah. Absolutely. I kind of love where you're going with that too, because I think any sort of disease, something that we're going through, it really is about blood flow. Um,
Hmm.
I and just while we're here, and that's okay with you, as far as being a middle-aged woman, so how is that impacting diabetes life? You're a mother of 4. You've got your hands full on a lot of different levels. Yeah, so how has hormones impacted you?
I mean, not that I think, I know a female's cycle affects you your whole life. And yeah, it's
Mhm.
not fun coming into this stage of life, not knowing what the heck is going on. Like, I'm glad people like you exist. And I have a couple people through my endocrinologist's office that'll help you with this stuff.
Good.
And I feel like there just has to be more studying and education
Yeah.
on the female cycle. Not to say that men don't go through it, but it is different and it impacts me. It always had, like, badly.
Mm.
For example, right before, like when you get your period,
Mhm.
my blood sugars would be super high,
Yep.
higher than normal.
Mhm.
Talk about rheumatoid arthritis. Right up to that point, my symptoms all get worse.
Mm.
And I don't even know exactly what menopause is going to do,
Yeah.
but I'm prepared to not know what the heck is happening.
Yeah. Yeah.
That's really hard. And I've
Yeah.
always searching. I have found some doctors who know stuff about hormones. Nothing has been like the cure for me or the way to stay stable, but it's hard being female.
Yeah, it is. And it's, it's the same, but can be very different for each of us, with your added, having the arthritis on top of it. So that adds another layer that, that I can't relate to, but I can just
Mhm.
imagine, menopause is hard for all women.
Yeah,
We're
yeah,
starting to get talk where, the experts are definitely starting to come out. Lots of books are being written. But I think it does start, and you just mentioned it starts with the education and the medical school. So it was never part of the medical training.
right.
So a lot of the
Right.
experts are going back to school because they're seeing the need. And in most cases, it's because they've personally felt the need. So that's kind of prompted
Yeah.
them. And that's really been my, a reason not only to have the podcast, but to write the book that I've got coming out
Mhm.
is that I suffered and I still stumbled. And then I look back and I'm like, well, gosh, nobody told me.
Mhm.
And I don't want that to happen to the rest. I want the
Yeah.
other women to be more prepared. Yeah, that's our mission, is just to help and to serve and provide that information, just
Mhm.
because it's important. We have a lot of great things to do here and we want to feel our best when we're
Yes.
doing it. And
Absolutely.
all the things that you're doing with the community and raising families, and we want to be a functioning part of society.
Absolutely.
And this is a term I've heard. Some of the experts, some of the hormone doctors in the field, they, like in the clinical setting, we were termed the whiny women because that's just what happens to women. Just another whiny woman, It's
Mhm.
like, well, they just have to get used to this is the way it's going to be. It's menopause. That's what happens. It's part of aging. And
That's
then
not.
I know it. And then you tap on chronic disease for women like us. And so, gosh, I mean, how worse does
Yeah.
that conversation with the doctor
Um,
get then when it's like, well, I'm so sorry. You're used to suffering. You're used to it
yeah.
being tough your whole life.
Right.
What's one more thing?
One of our
Yeah.
children suffers from endometriosis, and we've
Mm.
been in and out of hospitals, and quite often females are not believed. When we're going to the hospital, it's usually the ER because she's screaming in pain.
Oh.
Thank you. That's not why I
Mm.
bring it up, just because of
Yeah.
the cycle, right?
Yeah.
That's a lot of these females can't have babies because of it.
Mm-hmm.
But anyway, point being, there just needs more research education there, because
Yeah.
very often they'd say, well, you're very anxious now. And I did believe her, because no one screams like that out of nowhere for hours,
Sure.
starts vomiting. Like,
Yeah.
finally, I would get in arguments with doctors like, yes, anxiety's part of it, one part. Because if you know you're going to be excruciating pain for hours, I'd be anxious too.
Sure.
But I know my daughter's telling the truth. We also got a diagnosis through surgery. But yeah, so for females overall, and apparently some men can have it too.
Yeah. Yeah. Oh, yeah. Yeah. There's definitely some things too that they have to, yeah, this is the kind of world we're living into. I think we're living in a different society with different levels of all these things kind of coming at us. So we definitely got to keep our armor on, don't we? And our health
Yes.
is the most important thing.
Mm-hmm.
And I want to thank you for what you're doing and,
Oh,
what you're
thank you.
doing and your passion and time and commitment that you're putting in to the health savings experts. Is there anything else that we need to know before we go today? Maybe something I left out that's important?
Not that I'm sure we'll hang up, and then I'll think of, just for people to, just think about if you've ever saved $1 on something related to your health care, something minor like that,
Mhm.
or a way you got your medication that was denied, which is why I'm kind of keeping track of everything I'm going through. So I can say, hey, it was denied again. It was denied 2 more times, and this is where I'm at. Hopefully I'll get it.
Yeah.
Yeah, just try and share at the website if you can, or go and tell your story. Even if you just want to vent,
Mm.
I don't want it to be a negative space, but sometimes it's just good. I have
Yeah.
found to
Right.
talk about this stuff and have
Right.
people are like, yeah, I get it. I get it.
Yeah, yeah, me too, right, right,
Mm-hmm.
yeah, yeah, so how many
Yeah.
people say that? Yeah, I think that is the most important step too, is just to feel
Mm-hmm.
validated that it's not just you, that this is tough, these are
Right.
some things that we're coming across, and there is help out there. for
Yes.
sure. So
And yeah,
really good.
the healthcare crisis in the US is not going away
Mm,
soon. So
It's going to take time.
gonna take time, but that's another great thing about this hub. Let's
Yeah.
just let each other know. Here's ways you can save money.
Mm,
It's not useless. Yeah.
yeah.
Or
Yeah.
like not useless. I don't want to know.
Yeah, yeah. Oh, yeah, yeah. I totally get it. It's kind of like that. That no, we were talking in here recently about a cure, and I've talked to some other organizations. Matter of fact, Breakthrough T1D is that's definitely something that they raise money and raise funds to. And just, I think it puts it in perspective. I was talking to a man that represented them just the other day. We got together, and he was just sharing what was happening with the business. And again, it's something that I want to be able to maybe share here on the show just to kind of get, again, more awareness about what
Hmm.
these chapters and these organizations are doing for us and how we can be part of that. But I think one of the things that he was surprised that I shared was, the cure is amazing. I mean, that's something hope filled, and it's something that we all, really, we pray and think about. But it's the day to day that we're in. And
Hmm.
we need peace and solid solutions today.
Hmm.
All that in the future is wonderful. We can hope for that, but we're not going to necessarily rely on that. I mean, we can't. It's like just living in the present moment. And sometimes the present moment can feel pretty sticky and
Yeah.
hopeless. But things like this, I think, is what's helping us get through this stickiness. I can't tell you how many clients I've worked with over the years of all ages and stages that and in some cases, they're really focusing on that cure. Oh, well, if the cure just came, all my problems would be gone and solved. And again, that's a nice way to maybe look forward to the future. But it's like, no, let's just focus on today. Let's focus on what you can do and influence to help yourself today. And yeah, the health savings expert is a perfect example of what we can do today,
Oh,
right?
exactly. Exactly.
Yeah. Yeah.
Okay. Well, I'm so glad we met sort of in person.
Yes, yeah, this is as good as we'll get for now, right? So I'm in Florida, you're in the Philly area?
Yeah, right outside of
Okay.
Philadelphia. That's why I had said to you, "How are you surviving the storm?" I didn't know you were in Florida. You're like, "I'm fine."
We got some cold weather though. We were in the upper 20s it was about
Yeah.
10 days ago. So that cold front that came through got us pretty good here too.
Yeah.
Yeah, we lost all our trees and all the things we all have to just kind of get
Right.
through when weather things happen. And if it's not
Yeah.
that, then it's hurricanes that rush through. So
I know.
anyway, we all have something, right? Besides our health, we all have some sort of weather interaction that's going to disrupt life for
Yes.
sure.
Yes.
And all setting in. So how can people get in touch with you and learn more?
Yeah, you can directly go to the website and you can message me. I'm on Instagram and TikTok and kind of Facebook. I don't know what's happening there. It's just not doing so well. And I don't know, I would try and watch some of my videos, might help you. But yeah, I directly message people on those social platforms. And the website is still so new. You could give
Yeah.
your stories, we'll write
Okay.
back. Yeah.
Really good. And again, to take, to contribute to your site and the stories and to obviously learn from them. So it's definitely give and receive,
Hmm.
which is the way it's modeled, the way it's set up. So that's
Hmm.
really good. And this is
Yeah.
such an easy thing that we can all share with other people. Again, this is for chronic disease management and all of those costs. So it's really good. Thank you so much for what you're doing. And I will
Yeah.
definitely link it all right here in the show notes to make it easy for everybody. And it's your contact information as well. So
Hmm.
definitely connect you there so people can say hello. Well, thanks
Yeah.
again, Sally. It's been a
Thank
pleasure
you.
to have you here, for taking the time to share this with us and
Yeah, no, thank
keep
you.
us up to date because I know this is something that's continuing to grow and grow in a
Yeah.
beautiful way and
Oh,
continue to reach people.
I didn't even say it.
Yeah.
The guy who works with me is gonna kill me, but I haven't said
Ah,
it yet. We have a YouTube channel now.
okay.
That is really doing quite well
Okay.
because you can figure out what words people are searching because
Oh,
we want them to come there, like, organically
hmm.
because they're searching this stuff, right? And that's doing quite well, and there's just a ton of stuff there as well for the YouTube channel,
Nice.
which
Yes.
is Health Savings Expert.
Okay.
That's the
Really.
YouTube channel.
Okay. Awesome. And I'll be sure to link all that. Yes. Yes.
Okay.
Yes. And of course, this video will be on YouTube as well. So while you're on YouTube, just kind of hop
Okay.
around to different channels.
Yeah. Yeah.
And yes, I got to follow your channel as well. So really good. Thank you so much. And that's what I like about those, those hubs. Again, that word hub comes up. It's everything is
Yeah.
centrally located, and you can stay in tune. You subscribe to the channels, and you can get
Yeah.
all the video updates. So it works out
Hmm.
really good for the users. Well, thanks for being here, and be sure to share this show because we know that there's some other people out there,
Absolutely.
men and women, that need this
Mhm.
information as well. Y'all have
Yeah.
a beautiful day.
Thanks, Melissa.